Stop it. Going away. Oh, there it is right there.
So Anne, we have a quorum of board members, but I believe Georgiana Schuster is also planning to be here. So we can start whenever you want to, if you want to wait a couple minutes. Here she is.
Okay, well, very good.
And we know that Sue Suter will not be joining us today. So before you get going, I want to just say this is the regular December board meeting of the Champaign County Developmental Disabilities Board. And I am in the Shields Carter room, which is the regular meeting room. And that is in order for us to maintain compliance with the revised Open Meetings Act rules as revised under the emergency, the public health emergency, which continues.
Thank you, Lynn. Okay, Stephanie, I see you're here. Would you please do the roll call?
Debrush.
Here.
Georgiana Schuster. Sue Suter. Kim Fisher.
Here.
Ann Robin.
Here. Did Georgiana say here? I didn't hear her.
No, she didn't.
I think
Is
she's
she
muted.
Georgiana, you can unmute yourself.
I'm here.
Okay, there you go. All right. Okay, so everybody has successfully done the Zoom instructions, and I'm open for approval of the agenda as sent out. This is a decision item.
I will share the agenda so that people can see what you're about to approve.
So moved.
I
Second.
will second the move.
Okay, we have to do a roll call vote.
Georgiana Schuster.
Yes.
Kim Fisher.
Yes.
Debrush.
Yes.
Ann Robin.
Yes. Okay, is there any citizen input or public participation today? And I want to remind people that this is not the same as the successes and sharing agency information successes that we will have later in the meeting. So this would be of a substantive policy type of discussion. Okay, hearing none, I will follow my usual rule and open it up. If anyone comes forward later and wants to participate as a citizen or the public, we will certainly open it up for them. And I hope the other board members would be in agreement with that. I'm going to make some very brief comments. First of all, thank you for being here in December. And second, really related to the agenda today, I went over the expectation of time for the agenda with Lynn yesterday, and the expectation is an hour and a half. So we will try to keep it to that, but we don't know we'll keep it to that. The first half hour is going to be all the decision items. And the second hour is going to be some very interesting and informative presentations that I'm sure everyone would like to participate in. But the business part of the meeting is going to be done in the first 30 minutes. The biggest thing that we have to do is under old business, the 3-year plan, the 2023 allocation priorities, and the CCDDB funding guidelines. We've had these available online and printed out for several months now, starting in the summer. And my feeling is that we've had quite a bit of substantive discussion, which I hope has been helpful to everybody. We've received quite a bit of feedback from agencies and consumers, and staff has done a magnificent job of cleaning up the language to make it more accessible and user-friendly. So I'm hoping that we can just go ahead and approve these things today without much changes or without any changes. That would be my hope. I also want to say, Lynn and I talked yesterday, these are documents, are living documents. This is not the final word. This is necessary by law and regulation for the agency to move forward into the next calendar year and the next fiscal year. We have to approve something, and this is the best effort to date. That doesn't mean that this is the final thing that will be forever. And these are really living documents. So whenever people have suggestions or corrections or questions or something they think is left out or needs to be changed, Lynn has assured me that staff is very accessible and willing to take a look at these things so we can continue this throughout the next year and beyond. And other than thanking you again for being here and wishing everybody a healthy end of the year, that's my comments. Lynn?
Well, thank you. I want to share that I put a link in the chat to the full board packet for anybody who doesn't have the board packet. And I'll be sharing the screen at certain points to show you what the board is talking about. I really don't have anything to add to that other than we are still doing a lot of our work in a hybrid or distributed model. And with the continuing increases in serious cases of COVID in this community, I feel like I'm quite grateful that we're able to do this, because there are a lot of people that we know are suffering now, and in spite of their efforts to stay healthy. So I appreciate that folks have been willing to continue to do these meetings remotely, and that we can do that under the law. I don't really have anything else to say. This is kind of our wrapping up 2021 and getting ready for 2022. And I parked myself as close as possible to holiday cheer. So I think we should get on with the show. So I think minutes are the first thing. You ready?
Ready.
All right. So there are two sets of minutes here for approval, and those are from the board meeting on the morning of November 17 and the joint study session later that day.
And I'm back.
Do you want to call for a motion?
Can I hear a motion to approve the minutes, please?
I move to approve the minutes.
I second.
Okay, any discussion? Hearing none. Stephanie, would you do the roll call, please?
Kim Fisher,
Yes.
Deb Rush,
Yes.
Georgiana Schuster,
Yes.
Ann Robin,
Yes. Okay, we'll move on to the old business, and I seem to be having a little bit of a connection problem because I got lost, and it seems like you all were still able to hear each other. So I'm working on my iPad, and I'm gonna open up my computer and see. I don't have a camera capability on the computer, but I should be able to use it to follow along. So the first thing is the 3-year plan, pages 9 through 22. And there is a decision memorandum. Would anyone like to make a motion?
I'll move to accept the 3-year plan with 1-year objectives for 2022 as presented in the packet.
Okay. It's kind of good if you read the thing as it is in the packet. Did you do that?
No, I'm on the wrong page. I'm at the agenda page.
Okay. Page 10.
Okay, there we go. Okay, motion to approve the proposed 3-year plan for fiscal years 2022 through 2024 with fiscal year 2022 objectives.
Which basically says the same thing. Thank you very much. Any second?
I'll second.
Okay. Any discussion on the 3-year plan?
I have just a comment, not a change. I just think it's kind of wordy, but
It is.
that's, like you said, it's a living document and we can make changes to it as we go along. So that's the only comment.
It's
Kind
true.
of weird.
Before you know it, it's going to be September or October of 2022, and we're going to be working on new objectives. And I will remember that
That I said that.
because really, I think we can always work on that. Yeah, thank you. And we tried to, make it a little bit more visually accessible this time, but yes, it's wordy, so we can work on that too. But for getting us through 2021, this is what we came up with in the end.
Okay, thank you.
We got some really helpful feedback too from stakeholders.
Any other comments or questions?
I just have a couple comments. So I just want to thank the staff for including the information around DSPs in some of the objectives, adding that information, and just the format. So having the logic model pieces with the goals, it's really helpful to, as a new person, understand kind of how it links to the theory of change model. So thank you. And looks great to me. So I think it provides a lot of flexibility for agencies to think about what they want to do in a different, lots of different opportunities, I guess, with the goals and objectives.
Well, I think that's the goal, is to provide people opportunities. So thank you for that comment.
I think a lot of this document is as staff, this is our compact with you as the board. So a lot of this is stuff that we will do, and some things board members get involved in as they have availability and interest. And then there's the laying out the framework for the priorities, which also change every year. So thank you.
Okay, any further comments? Then I think we're ready for a roll call. Stephanie, please.
Deb Rush,
Yes.
Georgiana Schuster,
Yes.
Kim Fisher,
Yes.
Ann Robin.
Yes. Thank you all for that. And the next one is on page 37.
Oh, you're looking for the motion. I'll get there.
Well, the motion is on page, no, I'm sorry. The next one is, everyone was put in the front except this one. This one was put in the back. So the next one is actually on page 36.
There it is.
And then the last one is on page 37. So the one about the allocation priorities and decision support criteria is on page 36.
I didn't have the right page on the screen.
With all the
Got it.
document preceding it.
Yeah.
I'm open for a motion.
Motion to approve the CCDDB program year 2023 allocation priorities and decision support criteria as described in this memorandum.
And I will second that motion.
Okay. Now, what discussion do we need to have about this?
I
Any
just want to make
discussion?
one comment that relates back somewhat to what Kim's last comment that I really appreciate embedding in this document. the importance, you know, in writing of our DSPs and technology. Both of those are, I just really appreciate all the work that went into really amping up those two areas of concern.
Deb,
Yes, thank
could
you.
repeat that, the amping up on the technology and what else?
Yes, on how important we believe as a board that globally, including technology and a focus on our direct support personnel problem, how important those two issues are to us as a board, I believe. I really appreciate that that's amped up in writing in all these documents, actually.
I agree.
Thank you for that comment. Any other comments? Are we ready for a roll call?
Georgiana Schuster,
Yes.
Kim Fisher,
Yes.
Deb Rush,
Yes,
and Robin.
Yes. And thank you for that. And the next one actually is on page 37. It is the CCDDB requirements and guidelines for allocation of funds. These are all related documents, obviously, and there is some repetition, which is good. It means not just repetition, but consistency. So I'm open for a motion.
I'll move. A motion to approve the proposed Champaign County Developmental Disabilities Board requirements and guidelines for allocation of funds.
I second.
Okay, any discussion? Well, I already made a comment that there's consistency between the documents, which I think is very appropriate. Any other comments? All right, I think we're ready for a roll call.
Kim Fisher,
Yes.
Deb Rush,
Yes,
Georgiana Schuster,
Yes.
and Robin.
Yes. All right, thank you everyone for that. And we actually have accomplished, I had allowed 25 minutes for this first page, and we have accomplished it in 16 minutes, according to my watch. So I think all of the discussion that we had previously was very helpful. And let's go on to the SILA update.
So I also want to thank you all. There was a lot of really helpful conversation about those 3 documents that you all just approved. I am, committed to the continuous improvement process, but, we need a stopping point for each one in order to move forward with our processes. But the dialogue has been really great. So then on this one, even more helpful information and dialogue. At our attorney's advice, I included a couple of board members in a conversation with the realtor. Unfortunately, we had to do most of that by email, but one board member met with Kim Bowdry and myself at the house, and we looked at the house, and we got just very few updates. So this is really kind of a streamlined update from the one you saw last month. There's not a lot of new news. The emphasis is really on the most important work that needs to be done is to deal with the water damage that was created in that bathroom and underneath it. And we haven't got a second bid yet. That will take place on the 20th, which is next Monday. And once we have 2 bids, we can engage for the work. And once the work is completed, the house will be in good shape to be relisted. And because the market changes from month to month, the realtor gave us this update on like his analysis of the current market. This is related to questions that board members had. So there's not a lot really to do with this, but I think it's good for me to just keep bringing you each month whatever I've got. And it's not a huge amount this month, but this is so important. And I know that people have a lot of clarity about real estate that sometimes I'm not as savvy with this. So it's been a really nice collaborative process.
Okay, any questions from the board?
I have a question. Lynn, I don't know if it's written here and I've missed it, but what was the asking price for this second house? What were we asking?
I can't remember if it was 249 or 259. It's
Thought it was
not,
49.
it was 249.
I think so, yeah.
And I just went through and calculated all the things that we've paid for already.
Mhm.
And they've added up to 26,000. And so what I'm wondering is our new asking price going to change?
Some of those repairs were things we had budgeted for this repairs that we were expecting to have to make this year. So I don't think that a lot of that will impact the price of the house, but the new work may.
The new work may.
And it is really like, he'll do an analysis when it's ready to go back on the market. But a lot of the work was stuff that we'd already planned. We knew we were going to have to do some work on both houses. So we already budgeted for it. So it doesn't really affect our predictions of what was going to happen. It does take money out of the fund. So I'm sorry.
I am not good at unmuting at the right time. So, sorry, go ahead and finish what you were going to say.
No, I think that's a really good question. Georgiana's question is a really valid one. I just don't know what to expect once it's ready to be listed again.
Lynn, I had a question. So in the report, it said that we're going to go back to the buyer with the repair. Can you just walk us through kind of what that statement meant and kind of what the thinking around that is?
I think we would probably start with the buyer who was interested, and through our real estate agent, they'll have a conversation with their real estate agent about whether there's still interest, and especially if there's a change in the price, because there were still some things that the buyer was interested in us doing with the house that are not going to be done, but the substantial like safety stuff has to be done. So I think the real estate agent's impression was that the buyer was still interested, but there's a time constraint for them too. So by the time we're ready, they may not be, but just to start there and then relist.
Okay, that's what I meant, is going to them first, and then if that kind of falls through, going to relist.
I think so, yeah.
Okay, cool, thank you.
Unless y'all would prefer that we not do that.
Well, we're probably not going to make that decision right now.
Right, okay.
Yeah. All right. Well, Lynn, thank you for that update. Any other questions or comments about the SILA? Okay, the next two items are the schedules and timeline. Lynn, do you want to make any comments about that?
We did a little bit of updating. One of the goals is to make all the print a little bigger in our documents. So we're trying to, like if we don't want to go to more pages and we have to be less wordy, but with the schedules, it's really kind of straightforward. So the major updates are in this one. This document is in every board packet. It has your meeting dates and what we expect the topics will be, but it also in italics has deadlines for the agencies, just as reminders. And I think as a group, the DDB funded agencies are very timely with their reports and with all their compliance documents. So I don't know if they need this reminder, but it's helpful for me too. So and then the acronyms, Kim Bowdry took a look at these and did some updates, and I had a couple things to change too. So we're trying to keep these as relevant as possible.
All right, thank you for that. Well, we are actually ready for the new business. I don't know, are our presenters ready?
Hi, I believe we are waiting on one person. We're giving her a call at the moment. Hannah just texted me. But she should hopefully be here soon. She's generally pretty punctual, so we weren't sure how long things would take before us on the agenda. If, you know, I think DSC, their group was after us. If you guys all are here already and you would like to go first, if that's okay with the board, then that's certainly fine for us. I apologize that we weren't able to wrangle everybody here.
Well, we did move forward pretty quickly.
So if you all, whoever goes first, that's great that, you know, that DSC is here if you want to go first. I want you to know that you can share the screen too if your presentation document is available to you. And if you can do that, you could go ahead and share the screen for best control of the presentation if you want. Otherwise, I've got it queued up and I'm ready.
Great. Let me just check really.
Do you want us to go ahead, Becca?
If you guys are all there and ready, I'm sorry to make you guys jump ahead. But yeah, if you're fine with
I'll
that.
let Kim and the self-advocates. Are you guys ready?
Yeah, so we just talked and it seems like we're ready. So if you guys would like for us to present first, I can share my screen and we can get started.
Can I do a little introduction of this group? Just so you all know who you're listening to. Our self-advocacy group has kind of transitioned with COVID. Your three presenters today are really part of the Beyond Abilities podcast group. They've been very instrumental kind of in this transition. Kim Taylor, the staff person, truly has just been kind of a guiding force to kind of help them when they decide the direction they want to go in. So Danielle is fiercely passionate about being independent. Ken Trell in the yellow is a rapper and a songwriter, and his words are very eloquent and very passionate. And Scotty is our technical guy, and he and Kim actually developed the PowerPoint. And again, Kim just kind of helped guide, and Scotty's the one who decided what order things went in and what they talked about. And the really cool thing is that over time, everybody's strengths have really just made this this group really strong and cohesive. And everybody definitely has brought some amazing gifts. So I'll turn it over.
Great, thank you so much. So I will go ahead, see if I can share my screen really quick so we can get that up. But I would like to say, so Scott uses, and he would like me to let you guys know that he uses a communication device. And sometimes since he types manually, it takes a little longer than somebody who speaks verbally. So we just ask for a little bit of patience with that. But let me see if I can edit this. Pull up our presentation. Okay. Can you guys see that on the screen? Is the slide presenting?
Yes.
Okay.
Very good.
Awesome. So you'll notice in the top right corner of each slide, it'll say who will be presenting on that slide. So you can keep in mind who is speaking at the time. So whenever you guys are ready.
So after what we learned and where we're going.
I don't believe it's yours. The title.
Oh, What does self-advocacy mean to us?
Stand up for yourself.
Speaking up.
Knowing your rights.
And getting help for those with disabilities and others that need it.
I am myself. I have choice.
And it looks like our slide for some reason is presenting kind of sideways, but that's Danielle on screen.
How have we been advocating?
Speak up for yourself. Speak up, self-advocacy
Group.
group.
Learn more about our rights.
Participated in activities that allowed us to practice self-advocacy.
Gain skills needed to speak up for ourselves, and we discuss self-advocacy issues as a group.
Rights we've discussed so far.
Right to opinions, advocating for change, right to view clinical records.
Right to community activities and leisure. Right against coercion. And right against abuse and neglect.
Right to
Privacy.
Right to speak,
Relationships.
Right to work.
Right confidentiality and right against discrimination.
Every human has rights.
Yep. That's right.
Beyond Ability podcast.
So the podcast provided an outlet to talk about important topics with other members of the community. It was an opportunity to discuss issues people with disabilities face with leaders. The participants became familiar with new forms of technology, and some members even conquered fears of interviewing. Kentrell, I know you had talked a little bit about your experience when we were coming up with all of this. I wasn't sure if you wanted to go ahead and share what it was like to interview.
Yes. So again, if you didn't catch that name, my name's Kentrell. The fear conquer my interview was the July 19th interview.
Yeah, I think it was 2020 or 2021.
2021, I believe so.
Yep.
So anyways, I was kind of nervous because I didn't want my image of my talent being just really like exposure, people getting my autographs and stuff, keep it low key. But I conquered it in like so many ways, and I'm grateful that I'm here for what I am today.
Yeah, and you did a really excellent job. And I believe you were interviewing. Do you remember who it was specifically? Was it the president of Parkland?
Yeah.
Yeah, so it was someone that was a community leader that Kentrell came out of his comfort zone to interview through a almost like Zoom, but it's called Squadcast, and we'll kind of talk a little bit about that as well.
what technology we use for podcasting.
So Squadcast, like I mentioned, it's an online interviewing website that records audio. It's like Zoom. You can see other people's faces, but it doesn't record the video. Audacity, it's a program used to edit the audio when we record things. Canva is an online website used to create social media art. Facebook and Instagram, as some people may already know about, it's a social media platform that we use to promote each episode. Microphones are used to record voices during an interview. Computers are basically used to do all of that stuff. So we also use them to send draft emails to guests and access all the apps and websites needed. Contrell also brought up one thing that's not included on this slide is the websites that we post all of our audio to would be like, what's it called?
Spotify.
Spotify is one. And then there's Stitcher, other kinds of podcast websites that we use.
Spread the Word campaign episode. In this episode, we interviewed several community leaders to ask them how they are inclusive in the field, like the mayor of Champaign and the mayor of Urbana, the chief of police in Urbana, the president of Parkland College, and the dean of students at U of I.
Going home, keep
Rally.
rally.
Yep. So in 2021, advocates participated virtually in the Going Home rally. This is a rally to let legislators know that more opportunities for safe and affordable housing need to be created for people with developmental disabilities.
Speak Up, Speak Out Summit.
Even though the summit was virtual this year, we still learned a lot. This year, we joined as a group at a local library space for one of the 3 summit days.
Advocates learned more about our right to be treated the same as everyone else, having choices, gender, pronouns, and sexuality, healthy and unhealthy relationships, and consent and sexual violence.
For
Future.
future, a judge,
Advocacy.
advocacy, program.
Yep.
LEAD program. When businesses receive LEAD training, we believe it will be useful and inclusive to have representation from advocates.
first responders, we would like to be included in the education of police, firefighters, and paramedics about responding to emergencies involving people with disabilities.
DSC staff education. Advocates would like to expand our role in educating new staff about the rights of individuals served during the hiring process, as we've done in the past.
Anti-D system. We like to achieve an easier way to understand the bus system with safety in mind. It's easy to get lost in the community.
And Danielle, I know you mentioned to me one time about how you had gotten lost in the community. Did you want to talk a little bit about that experience, like how that felt?
It felt terrible as I got lost.
Right.
And I I didn't know what bus I could take, and on the bus, I talked to some city buses and stuff. He said, you went on the wrong bus, you could be going on the red or the green bus. And I just got lost.
Was it kind of confusing for you?
Yes, it was.
Gotcha. Okay. Thank you for sharing that.
You're welcome. Living independently. We would like to see more people living independently.
So teaching others about their rights. Advocates believe this is a super important topic. We'll be working on helping others learn more about their rights and advocacy. That'll be a really awesome part.
After 65.
Group offerings. We would like to see more groups center around career and independence topics.
Marriage equality as it stands, people with disabilities will lose a lot. When getting married, we want to see marriage equality.
Alrighty. So public speaking, we want our voices to be heard. We are currently working on a proposal to speak at the 2022 ARC of Illinois Annual Convention, which as of today it has been proposed, and they are, seems like they're discussing it amongst their own team. Our topic would include the importance of people with disabilities being involved in community hiring and training programs like ours.
What does the future hold? Being more involved with DSC hiring and employee training, discussion with leaders about changes we like to see in our community, continue to look at what's working and what isn't, and reaching out to other self-advocates in the community.
What are your plans?
speak to leaders about our issues.
Get more involved in the training of staff, teachers, businesses, and responders.
Talk with legislation.
Continue to educate others in the community.
Okay, so closing. So to sum it up, COVID-19 has had a huge impact on our community's health and services. Regardless of this, advocates have been able to achieve so much. What we couldn't do in person, we did virtually. We learned a lot about technology and connected with others through it. We've been able to use this time to think about what needs to be done in the coming future, and we're excited to bring about that change.
Thank you so much for that amazing presentation. And thank you to all the presenters. This was really wonderful.
Thank you
Excellent.
so much.
Thank you.
Yeah, I just want to second what Anne said, that I was at the edge of my seat listening in and all the work that you do. And it's really helpful just to learn all the different things that you all are doing. Couple things that I thought was really impactful. Danielle, thank you so much for sharing the story. That brought tears to my eyes about getting lost in the community. And I want to thank you for sharing that story in such a public way. And it just really makes me better understand how important working with the MTD and other agencies is for y'all. And then the second thing I wanted to just say was about working with the first responders and how important that is. And I'm just so glad that you all are thinking about that. I was reading Chandra's report at the end of the packet, and there was some discussion about the importance of the police and their understanding and working with people with disability, in particular intellectual disability. So I'm excited that you guys are thinking about working with them. I think they probably are as well. The police department, I'm sure, is as well.
I just want to say that what was impactful to me, well, it all was, but in particular, the highlighting by the self-advocates that in our own LEAP program that's funded by the DDB, there is not currently, I believe, self-advocate representation. That's really eye-opening to me, something that really hit home to me, and something that seems like it should have been a no-brainer from day one. And so I'm proud of those self-advocates for bringing that topic to my attention in particular. And I really hope that moving forward, we really think more closely about how important those self-advocates are to potential employers in the community and having their voices heard.
I would agree with all of that, and I would say, I hope this work goes on, that this self-advocacy group continues and speaks with all the legislators and the police and the firemen and everybody. I think it's really important. I hope that it goes on. Thank you for your presentation today.
You're welcome.
Thank
Thank
you.
Can I just add one thing just to extend on what Georgiana, what you just said? So there, like last night, the city council in Champaign had this discussion about this major investment in the community to decrease gun violence. And not that this directly speaks to what we're talking about, but then I know that the county board has just been discussing so much about the recovery plan funds. And I think it would just be so important for you all to take some of this advocacy work that you're doing and actually speak to, at these board meetings, just like you're doing here, to share your story when money is being decided is really important so that you can be centered in that conversation.
Yes.
May I jump in? I know it's a board discussion.
Yeah, no, go ahead.
I think that you all could do that anytime the county board is having a regular meeting of the board or a committee of the whole. They are talking about that ARPA funding. And they also have a Justice and Social Services Committee. So I think anytime they meet, they would welcome information from y'all, and they have public participation at the very beginning of their meetings. So and I think they have one tomorrow night. So I would suggest checking out their calendar and finding a time that works for you and just showing up at their meeting and saying you want to give public input, because I agree with Dr. Fisher. This is really important stuff to our whole community. And these boards and city councils have sort of, they don't typically have millions of dollars to allocate. So they're in this sort of moment of like shock and assessment. The more information they can get, the better and the more comfortable they will be with these really tough decisions. So if you want me to put their schedule into the chat, I will do that during the next presentation.
Yeah, that would be great. Thank you so much for that suggestion.
Thank you.
Can I just say one more thing that had struck me too? So the plans around getting involved in like the training of staff and teachers in particular, since I'm a teacher and work in schools a lot, I thought that's really important, especially thinking about training both special education and general education teachers about all the skills and knowledge that Danielle and Contrell and Scott, you have. So all the technology that you have, I know is not always included in the education of students with disabilities at the high school level, even if general ed students get those kinds of training. And then just this idea of like civic engagement and advocacy at board meetings. Again, that's included in like a civics class, but if you don't have access to that class because of your IEP, then you don't get that exposure. So the more that you can collaborate with the schools, I think would be just phenomenal. And I know it might even help teachers do the things that they want to do with their students, and the students get to do the things that they want.
We got one.
I think I got a story behind that because this happened to me as well. Now, I was a student at Champaign High School. I was supposed to be getting the notes because of my IEP from my social studies teacher. Come to find out, he tried to tell me, you can't get the notes because you're not an IEP. But then when he sat in one of my meetings, he knew that I was actually still on the roster for IEP, which he didn't know. Even after I advocated that I need the notes because it was hard for me to follow his instructions for tests and everything else.
Control, that is excellent example of how important this is for you all to work more closely with teachers. That's great. Thank you for sharing that story.
Thank you, Control.
I got one.
Of course.
I got bullied at one of the kids pulled me after those was the teacher for the little kids, and he came up in my face and said, "You are this honky and all that stuff," and I didn't like it. And I was going up there and say something to the principal and the teacher because he came in my face because I was teaching the kids how to stay outside for recess, and the kids didn't want me to leave. They were all want me to stay because I was helping one of the boys to help one of the kids. And he came out and pulled me out, and I didn't like it.
I think, Danielle, you bring up a great point about how important it is for not just the people that you work with in a school, but also all the other people in a school who don't get training or don't have knowledge about, all the skill and success that you have is really important. So that's another great example of working with the schools in all members of the school. Thank you.
Thank you, Danielle.
Well, thank you again to everybody for sharing. That was really, really wonderful. I think we'll move on to the Community Choices presentation. And I want to thank all of the presenters from the DSC advocacy community leaders again. Thank you so much. And we'll look forward to working with you going up forward. We hope to hear from you again.
Okay, if you guys are ready for us, I think we are all here now. Thank you for being flexible with the schedule, and thank you guys for going ahead of us. I know when you're like on an agenda, sometimes it's stressful to jump up ahead. So thank you guys. You guys did great. So Hannah, if you want to share your screen, I think we can get started.
I can do that.
Okay, is that working for everybody?
Yes.
Okay.
Okay, well, I'll just give the group a quick introduction. So we call our advocacy group is called the Human Rights and Advocacy Group, or the HRA sometimes, in our love for acronyms. And we have been working together for several years now, and have done a number of projects together. It tends to be a very project focused group. They sort of choose topics amongst themselves, and then kind of negotiate what we're going to work on at any given point. So we're just going to be going through and talking about some of the things we've worked on in the last couple of years. All right. You want to go to the next slide, Hannah? Yeah. And so then I'll let everybody introduce themselves.
Hello, my name is Sarah Demisay. I'm the co-facilitator for this group, and I am very passionate in finding it, keeping it, building and maintaining meaningful relationships and connections with other people through self-advocacy work. I wanted to co-facilitate the HRA group because I wanted to be able to have an opportunity to share my experiences and to encourage others to find their voices through empowerment.
Hello, my name is Eric Beasley. I like to share ideas about the people need and the needs to be heard. I'm passionate about the people showing respect to autisms and not autisms.
Hello, my name is Jennifer Bowie. I wanted to be a part of the HRA group because I like advocating for people with disabilities and myself. I'm really interested in people with disabilities having a voice in the healthcare and human services. People need to be able to get the essentials like food and housing. It's necessary for everyone, regardless if people have disabilities.
Toby couldn't be here today, but Toby is also one of our longtime members at Community Choices and has been involved with the HRA group and then like the many iterations of our advocacy group before that. So.
Hello, my name is Isaac. I am using a communication device like Scott. I am in this group because I am passionate about disability rights. It is important to me to fight to make life better for all disabled people.
And let's see. And so Jazz Davis also couldn't make it today. I believe he had to work, but he's been involved with our HRA group for about the past year. And then Hope Holland, who some of you may know, is a community member and a student at the University of Illinois, who also has been a part of this group for the past 9 months or so. We wanted the group to include members at Community Choices, but also community members who have disabilities as well. And then I'm Hannah. I'm the Associate Director at Community Choices. And this is probably one of the most favorite things that I do with my job. I really love co-facilitating this group with Sarah and working with everybody in this group.
And you all know me too. I'm Becca, and to echo Hannah, this being involved with this group is absolutely a highlight of my job, and definitely something I value a lot, and value all of the work that the members of the group do. So yeah, so thanks for having us.
All right, so we're going to start with some of our past projects.
Some of our past projects included creating the healthcare professional guide to working with the people with the developmental disabilities, learning about the instaurations about disability rights and other rights movements, and creating the housing vouchers pamphlet.
I'm going to talk about the Healthcare Professionals Guide. We created this guide because we wanted people with disabilities to have a voice in their healthcare. This guide addresses what patients with disabilities can do, what healthcare professionals can do, and what support people can do to meet 3 major goals. The first one, healthcare professionals understand that I have a role and a voice in my healthcare. It's my body. 2, healthcare professionals adjust to how I communicate and respond in a way I can understand. And the third one, healthcare professionals focus on me and use my support people as a resource, not a stand-in for me. Let's look at the third goal as an example. Healthcare professionals focus on me and use my support people as a resource and not a stand-in for me. One thing patients with disabilities can do to help ensure that this happens is to make sure doctors know who they have permission to talk to. Something healthcare professionals can do is find a way to talk to the patient alone and ask them what they want. And how support people can help is to ask the patient beforehand how they want them to be involved. We shared and presented on this guide at the Carl Foundation Day, and we also presented to the Board of Promise Healthcare and their entire staff. This version of the guide can be displayed in healthcare offices and used as a training tool for healthcare professionals. We also created an individualized version of the healthcare guide that people can use to share the specific adaptations and tools that work for them when meeting with their doctors and other healthcare professionals. We presented both versions of the healthcare guide at the 2019 Speak Up and Speak Out Summit. And they are also available for anyone to use on the Community Choices website.
Okay, and we also spent time learning about the civil rights movements of many different groups of people. Here are some of the movements that we talked about: the civil rights movement, women's rights, disability rights, minority and other marginalized groups, immigrant rights, and LGBTQ rights. We wanted the group to have background information about each human rights movement so we could share those with other people outside the HRA group. This could be people who are part of the cooperative or other people outside of the cooperative. We thought it was important for more people to learn about those movements. It was also really important for our group to learn about intersectionality. Learning about these movements gave us some background information. We all have basic human rights, And we need to have all of our rights respected through intersectionality. We don't want anyone's rights to be excluded. The cooperative itself has to try to be intersectional, because a group that is good for disabled people but harmful to LGBTQ people means it isn't truly actually good for all disabled people, because we are those other groups too. We did this because to be good to disabled people, we also have to be good to poor people, to immigrants, to LGBTQ people, etc. This is because immigrants can also be disabled, people of color can be disabled, LGBTQ people can be disabled, etc. To put this into action, we developed a brochure to help people with housing vouchers, because people with housing vouchers can have all sorts of intersectional identities. This is what Isaac is going to tell you about on the next slide.
Our most recently completed project is this brochure that is aimed at landlords to encourage them to accept housing vouchers. We decided on this project because affordable, safe, quality housing can be extremely difficult for many people to find, especially disabled people, who are more likely to experience poverty than non-disabled people. Many disabled people, including both those who work and those who cannot, are not able to afford a safe place to live. Rent prices are high and there is no local rent control, so it can be very difficult to find a place a person can afford to live. This also means that people are frequently trapped in living situations that do not like or that are unsafe, because they don't have the resources to rent their own place. Getting a housing voucher can be life-changing in this way. However, finding housing is still difficult due to discrimination, and because landlords often refuse to accept the vouchers, even in places they are legally required to accept them. We wanted to help fight this problem by creating a flyer that people who have vouchers could take to their potential landlord. We wanted the flyer to convince the landlord to accept the voucher, even if they haven't done that before. We focused on debunking some of the myths about voucher recipients, like the ideas that voucher recipients are less likely to pay their rent, are destructive, or participate in illegal activities. We also talked about the process of accepting a voucher, which many landlords think is difficult and expensive, and explained why it usually isn't. Our group is diverse in our experience with vouchers. I knew nothing about them before this project, but other members knew more, and some actually are voucher recipients. One of them was even able to talk to their landlord to ask about what the process was like on their end. Meanwhile, some of us did research about inspections and requirements for landlords, so we could explain what the process is like. Other members helped figure out other benefits for landlords, find pictures, get quotes from other voucher recipients and landlords, and formatted the brochure. The end result is this brochure, which has been distributed to the Housing Authority and is available for anyone to download on the Community Choices website.
Okay, so what are we doing currently and in the future? So our current campaign is designed around the idea of increasing respect for people with intellectual and developmental disabilities. And so we're encouraging a community mindset shift through small projects and creating projects around it, like the additional areas of life, including like community, work, education, places you go for fun, things like that. And so Sarah and I were able to meet with staff at Visit Champaign County. And so our first two projects underneath this umbrella of increasing respect for people are partnerships with Visit Champaign County. And the first is the Chambana Welcome Crew, which is a project that is open to all the community, and Visit Champaign County recruits ambassadors to meet with folks who are moving to the Champaign-Urbana area and want to connect with people who have lived here for a while about things they might be interested in. So anything from like the arts and athletics to getting involved in local politics, involved in local schools, and learning things about like how to get involved with just community fun groups, meetup groups, things like that. And so when Sarah and I met with them, they were really interested in having some people from Community Choices become ambassadors, because our self-advocates can share the experience of what it's like to live with a disability in Champaign-Urbana. And so one of our members, Jen, who's one of the presenters here today, is going to become a Champaign Welcome Crew ambassador. And then we're going to partner together, so that way if a family is moving to town and they have an adult child with a developmental disability, Jen can meet with them and share what her experience has been like and some places that person could get involved. And then I can potentially meet with parents and tell them about how services work within the county and things like that. But it gives our members an opportunity to share their knowledge about the community with people just moving into town. So it's kind of cool. I kind of like that idea of being, not from here originally myself. And when I first moved here, it took me quite a while to like find my people and find things that I was interested in, and kind of get connected. So I think that's a really cool idea. And then the second project is called Accessible Champaign County. And I talked about it just a little bit at last month's board meeting. But what we're going to do is Visit Champaign County has tasked Community Choices with helping to create criteria around evaluating local businesses and community groups, and just basically anywhere you would go for fun, outside of your job, anywhere you go for fun, and evaluating those places on their inclusive attitude and their physical accessibility. And so the first part of that project is creating the criteria. And so we're involving, some of our members with disabilities, some of our family members, some community members, and we'll start working on that here in January. But then we're also going to have some other projects that fall underneath this umbrella of increasing respect for people with disabilities. Kind of what we figured out with our HRA group is that it can be a lot of different things depending on what you're interested in. And so having some of these small projects that allow people to pick and choose where their passions are, but with the main goal of increasing respect, seem to be very enticing for folks. And it also allows other people to get involved with the group maybe on a more short-term basis. So if they just want to help with this smaller project, instead of maybe a year-long, or I should say year-long, but like, a 3-month-long planning and project and presentation, they can get in for this little bit instead. So yeah, so that is the end of our presentation, and thank you to all the presenters for taking time to share today. Does anyone have any questions for our presenters?
Once again, that's an excellent presentation, and thank you to everyone for your hard work in your presentation.
Are you all ready for the next one? Oh,
no, I have like lots of things to say. So thank you to the presenters at Community Choices. Just like at the presenters with DSC, I was like at the edge of my seat. I appreciate the 2 projects you were talking about with the healthcare professionals, and the guide that you, I can't remember who walked us through that. Maybe it was Sarah.
I did. Jen.
Jen, it's okay. Thank you, Jen. That was so helpful, because when I was looking at it, I was, trying to figure out how to walk through it. But how phenomenal is this tool for healthcare workers? So one of the things I was thinking about is, I know it's on your website. Is there any plans to like collaborate with? Seems like this could be like a package training that Carl, Christy could be, they could, again, I know I mentioned this before last month, but like you all have such an expertise that many of these other organizations don't, right? So Visit Champaign County and Carl or Christy or any of the other medical facilities, they do not have this expertise that you all have. And I feel like maybe this is pie in the sky, but you should be charging for this. I mean, it's excellent expertise. And then the other piece I was, wondering what I was thinking about, and maybe Isaac, you can speak to this, was with the healthcare workers, how much of the training is around communicating with people who communicate in different ways, like a person who uses an AAC device. So how has there been any work with that? And, if not, is there a plan to? So I guess the first question, just to sum up, since I'm very wordy, is, how have you thought about, getting providing this as a business opportunity for training for the different healthcare providers and Visit Champaign County, and then specifically around communication and valuing people who communicate in different ways with the healthcare workers?
Well, we've been asked to present it, before and work with Carl. So we've done it a lot, and the individualized guide for the Speak Out and Speak Up Summit. I mean, I think a lot of people can benefit from that. I mean, because to take it with you, especially when you have a first time visit, you have this is your first visit with your doctor, somebody retired or they switched, it's like, so they can understand your needs and based upon this. But I don't know, since COVID, we haven't done any presentations. I guess they haven't been asked, but no, I would be willing to do it again. And I think we could do it as many times as if people ask us. I mean, and trying to communicate with like Carl, and then once I think and if the community wanted it again for the healthcare, so our community, that we would the Promise Healthcare again if they did it, or any other healthcare organization. But it's just like I'm so passionate about, and it's important now, and to have affordable healthcare too. I don't think people always understand that support people are supposed to be there to help, but not to be in place of the patient, too. So, I mean, that's been the most issue I've seen there's new technology out there that people can bring devices, I think, like Isaac, to say, yeah, as long, but I guess.
Yeah, I think just to echo what Jen's saying, if you don't mind, Jen, because I totally agree with it. Like Jen's saying is, we've had better success with putting the tools of hands of folks to be able to communicate with their individual doctors and build those relationships, and for self-advocates to be able to say, like, this is what I need, Dr. So-and-so, like, you have a relationship with me, this is what I need. We've had success with that than approaching maybe from the top. And not that we don't want to, because we have before and we would like to continue doing that. But like Jen said, for various reasons, I think COVID being one of them, but also just it's harder sometimes to get in at the top. And yeah, but it's kind of a top and down approach and meeting in the middle, hopefully somewhere. So.
Thanks.
You ready for the next presentation?
I want to thank everyone again for your wonderful presentation. And I think we do need to move on. Lynn, are you and the staff ready to do the presentation about the Community Learning Lab project?
We are, and I found that
Thank you.
the original of this presentation. It's so pretty. So Mr. Leon Bryson is going to present on this project, which was a collaboration of our team and 2 students. And I want to spoil the ending by telling you that these students got the highest marks possible for this project. And the most positive comments that I could come up with, and also some business attire for their internships, because we learned along the way that there are some other things that people need in order to join the workforce, especially when they've spent all their money on school, and that's a suit. So anyway, I'm going to turn it over to Mr. Bryson, and I will try to keep up here with the PowerPoint. Thanks.
Awesome. Awesome. Thank you. Thank you, Lynn. And so before we jump into it, I just want to say 1 or 2 things. I'm really honored to be here, to be a part of a solid core group here. And I love what I'm hearing. And one of the things that I'm really hearing from the different agencies are things such as value, the value of an individual, and respect goes a long way. And so that kind of ties into this presentation that I'm about to present on behalf of my colleagues. And so this is all about direct support professionals, DSP workforce shortage. And so the students worked on this project, this service learning project, for approximately three months. And what they were able to come up with, ascertain, was information, literature reviews from, I want to say, Ohio, Kansas, and Minnesota, right? And so here on the screen here, you can see all of the, the different sources of information that they were able to pull from. So if you go to the next slide, Lynn, is a continuation of the ongoing amount of work. They put in a lot of work for this project. And so here's another, the continuation of that list. The next slide, please. All righty, so now let's really get into the meat and potatoes of what we're here for. And so the workforce shortage. And so based on their research, they were able to determine, to find out that DSPs there's low wages and lack of benefits with DSPs. No surprise there. Lack of support from supervisors. This was very key here. The nature of the work that they're doing, increase in need, and lack of adequate training and promotion opportunities are limited. So here we are, we're talking about the approximate DSP salaries. And so as you can see from left to right, Illinois, the annual salary for a DSP is $17,641. Here in Champaign County, it's approximately $20,371. And at the nation level, it is $22,149. And so what that breaks down to is, for the state of Illinois, we're looking at the average hourly rate for a DSP is $8.48. In Champaign County, I was doing the math, and it's approximately $10.50. And at the nation level, it's approximately $11 an hour. And so Illinois, sadly to say, ranks 49 out of the 50th out of 50 states nationwide for DSP salaries. Next slide, please. So what DSPs had to say about their pay? Of course, it was not great. It is tempting to pick up extra days and hours due to the low pay. The field needs more pay as it constantly is competing with hospitals, nursing homes for employees. And we see that here in Champaign County. DSPs constantly work nights and weekends, so they would rather work at a hospital where this is not the case and the pay is better. This is especially true if they have higher education. The low pay gives DSPs no incentives to stay. Next slide, please. And so our students had a chance to, as I mentioned before, do the lit reviews and research. And here's what some of the interviews, their research presented. And so virtual interviews conducted with DSPs and their experiences. Often long hours, they worked hard, and inconvenient hours, which violated some of their rights. There's a lack of work and balance life. The salary was not livable. Communication amongst employees at all levels. The nature of work is very draining. They did not receive adequate training. Very minimal interaction with or support from supervisors. Racial inequalities were prevalent, lack of diversity among staff, and lack of cultural competency. Staff to patient ratio was not ideal. At times it was one staff person to 8 individuals. Little to no time to work on rights, happiness, and/or enrichment of the individuals with IDD they worked with. Instead, they were focused on meds, meals, and mobility. This is paramount. So what can be done? Increase pay. Currently, it's approximately $9–10 in Champaign County. Livable wage in CU, Champaign County, is $14.98. Poverty wage in Champaign County is $6.13. They also said we need to increase the awareness of job description and pros and cons with that, such as stigma, experiences with the individual with an IDD to gain interest in the DSP field. More opportunities, they ask for more opportunities for promotion, serve a broader spectrum of people, higher priority and better funding allocations for Illinois for services, and more supportive supervision. So we need to give them credit. So there are 3 things that they talked about: communication, know their strengths and community, create a workspace which welcomes self-advocacy and improvement. We also need to know their strengths, reward and acknowledge positive work efforts and attitudes. Also the community. The community is key. Create a community within the workplace which cultivates deeper friendships. And so if, I don't know, Lynn, if you can expand that screen here, yeah, there you go, thank you. Besides increase your benefits, increase your pay or benefits, what is the most important thing your employer could do to make sure you stay with them for the next 5 years? So and this was one of their survey questions. And so here it is: provide new career opportunities, provide new leadership opportunities. And so you can see here where, you know, the percentage is increasing. So, and I'm struggling to see this, but I'll give it a try here.
Here, I can do it. It's the most popular answer is show more appreciation for my work, which was a surprise.
Okay.
I think this is based on the national survey results.
Mm-hmm.
So that's the most popular answer, and then show more respect for my experience. So there's also, these are broken out into by like those who've been there for 6 to 9 years are the top bar, and then those 11 to 19 years, the second bar, and then 20 years or longer, if you can believe that. The smallest bar, I mean, there are people who've done this work that long. So anyway, that's
Gotcha.
That's the fine print.
Next slide.
Well, I guess when I blew it up, I made it harder to advance the slide. There we go.
All righty. So part of their research was and discovering was there is a need to promote racial equality. Make sure that everyone is treated equally. The DSP mentioned that they had been asked to sit during meetings for increased racial diversity and was told several times by the supervisor to fit in. To fit in. How can we address this? Require all employees to have cultural and racial diversity trainings yearly or as needed. Encourage friendly relationships. Acknowledge the problem, provide support, and discuss more acceptable behaviors. So in summary, DSPs are essential workers who are being overworked, underappreciated, and paid well below the national livable wage, which I believe, and I was doing some math on that, I believe it's $26,500. And someone can fact check that. DSP workforce shortage needs to be resolved to decrease employee burnout and turnover, and to increase the amount of individuals with intellectual or developmental disabilities who are able to receive services. This can be done by increasing pay, requiring supervisors to complete yearly trainings regarding race and ethnicity competency, and being an effective, and they should highlight that, effective mentor, allowing more areas for promotion, showing DSPs they are appreciated and supported, and being sure they receive adequate training. So how did the students contribute to this research? Well, they increased awareness by DSP workforce shortage. They researched and conducted literature reviews on topics on this topic. They provided a fresh viewpoint to the topic. They conducted interviews and created a survey for data collection. And I think, you know, as you go further into it, there is in the board packet, the actual survey.
I'm going to share that next. This survey has not been launched, but they created it for us to use. So this is a topic that that Mr. Bryson and Kim Bowdry and I talk about probably every day. And this survey is presented just for your information, but we think that there are lots of ways we could use this. So it's a little bit long, but if we can get DSPs to fill it out, we could learn some really good stuff. Sorry. I'm sorry, Leon. Go ahead.
No, you're fine. This is the conclusion of the presentation, but yeah, this is a great survey that they worked on. They got some good answers from DSPs that they interviewed. They did a lot. They put in a lot of hard work for this project, and so it speaks volumes. And I just love the fact that so many of the presentations today was right here at home, the people that are affected, the people that are doing the work. I think it's very paramount. And I want to stop preaching to the choir here, because everyone here knows what's going on. We just need to get the word out to those who are in power. So I'm done. I'll stop. Thank you.
I have one quick question. Has this survey been distributed already? Do you have answers yet?
No, but we had talked about how we might distribute it. It is hard to get information directly from DSPs. They're busy. So we've been talking about how we might do that, where we could put the survey, how long to leave it available. So we're just at the beginning.
Okay, and then the next question is, once we get responses from the DSPs, how can we make changes, like make changes to the wages, make changes to the training, make changes to supervision? How can we as a board?
So these people, DSP is a technical term. It is one role. It is in the DD field, no other, and it requires certain trainings. It is a category that's used across the country for people who provide direct services to those with DD. Because it's all funded through Medicaid, we can't supplement those salaries, but other entities such as ourselves are talking about things like retention bonuses as one practical, educational opportunities as another, paying people to complete e-badges. The National Association of DSPs has a very nice array of e-badges and DSP certifications and frontline certification, which are, the state of New York is going to pay people to complete those certifications, even if they already know how to do their job. So that's kind of wonderful. We're watching what's going on with New York's contract with NASDA to see like how that works out. I'm a little concerned about like, what is the message when you tell people, wow, we really value your work and we understand you're not paid well enough. And so instead of paying you more, we're going to pay you to get more training. Like it's a little bit of a mixed message, but ultimately it's a way that we could help to increase the compensation people receive. So that's one option. Another is paying people to complete a survey. Like that could help. But I think at the national level is where the change really needs to take place. And I've been talking with the National Association of County Behavioral Health Directors and National Association of Counties about advancing a policy resolution to ask for the Bureau of Labor Statistics to give a single occupational classification to DSPs. There aren't a lot of DSPs, so they don't have their own classification. Failure to have a classification leads to all sorts of things. And the things that are behind the low pay, like people don't really understand what this work is. And yet there are experts who know exactly what this work is and what it should be. So if there's a classification, then those people who know so much about this work could fill in behind that with what this really is. And then there becomes a much better foundation for which to talk about like reasonable wages, not just living wages, but real compensation for this most important category of work. So it's also really hard to get the Congress to do it. So it would have probably bipartisan appeal. So I'm working really hard on that route to get the message to Washington, DC, that this is across the country a huge problem. Prior to the pandemic, back in 2017 or 2019, the estimate was something like we would need to, across the country, we would need to have somewhere between 500 and 700,000 new DSPs every year. And what's happened is a 75% reduction in DSPs since the beginning of the pandemic. So we're so far beyond tilt that it has to be a federal action. But I think the local options are in those kind of like, whatever we can do right now, we should be brainstorming around that. And we've got some hopeful ideas in the chat and some people who want to be involved with that. So I think that'll be a nice discussion in the spring for sure.
Thank you for that.
Mr. Bryson, thank you so much for presenting this. It was great to hear all the work that the students did. If you can communicate to them how appreciative we are of having this concise information, that would be really great.
Absolutely.
Thank you.
I'd like to second Dr. Fisher's comment. Really, very helpful. Thank you.
I would second the idea, or third, or whatever, the idea of gathering the information from DSPs through the survey. I'd really be interested in what y'all are thinking we could use that information for. A couple of things that's kind of rattling around in my brain is the connection between the podcast self-advocacy work, the advocacy work related to, the tenant rights and healthcare rights, and DSPs, like how connected the issues are. So like people with IBD cannot do the things that they want to do unless DSPs are able to spend more of their time than on just meds, whatever that
meals and something.
Yes, exactly.
Something.
So, and then Lynn, when you were talking about the national change that needs to happen, I'm just wondering if there's something that us as a board could communicate to the agencies about how we can move some of the local advocacy that's work that's happening, connect it to national advocacy, whether it's connecting to Rodney Davis or as the representative, but definitely there is a campaign that's happening with the election, so making this a central issue in the campaign for 2022 would maybe be something we could think of, or it could be thought about, and then communicating with our senators, and then our state and our state representatives and state senator. I feel like even though that's at the state level, just getting that in, connecting outside of Champaign County and how important any federal legislation needs to happen, I think would be really helpful. So that's just a lot of word salad, but essentially I feel like a lot of this work is interconnected. And so it'd be great to see how agencies could help us move that work forward, and DSP, and staff, I guess.
Thank you. Well, shall we move on to the successes and other agency information? Does anybody have anything they want to present today? We've had a lot of good presentations today.
We have.
I think maybe people have had enough, but if anybody wants to come forward, this is the time to do it. All right, well, thank you so much for everybody for your excellent presentations. And I feel like I've learned a lot and gotten some inspiration, and we certainly have a lot of work to do. There's no question about that. Is there any CCMHB input, Lynn?
The CCMHB will meet this evening. You all are welcome to be there as guests, or this, as with your meeting, will be recorded and placed on the county board's website of our meeting archives. And they have roughly the same business that you all do, but their presentations tonight, they'll hear about this DSP project, shortfall project, but they're also going to have a presentation on the implementation of new crisis response services in Champaign County. We've waited a long time to hear about this. It's really important stuff. So I'm looking forward to that. Otherwise, it's roughly the same business. And then we, enjoy the holidays.
Thank you. Staff reports are in the packet. And again, thank you to all the staff for your excellent reports. It's always good reading to hear what you're doing. And thank you for all you're doing. Any comments about staff reports?
Just ditto what you just said, Dr. Robin. Appreciate it.
Okay.
Appreciate the information.
And board announcements? Okay, I think we are adjourned, and I wish everybody a very happy and safe holiday season, and we'll keep in touch.
Thank you.
Thank you.
Thanks, everybody. Happy holiday.
Bye.
Bye.
Holidays.